Are weight loss drugs like Ozempic the secret solution for painful skin problems? Over the past few years, weight loss medications such as Ozempic and Wegovy have become household names in the United States. Originally developed to manage type 2 diabetes, these drugs, also known as GLP-1 receptor agonists, are now widely prescribed for weight management. Their popularity skyrocketed when studies showed how effective they were at helping patients lose significant amounts of weight. But recently, researchers and doctors have noticed something unexpected. These drugs may provide relief from painful skin conditions like hidradenitis suppurativa, HS, and even help with other inflammatory issues. Could weight loss shots like Ozempic be more than just a tool for trimming waistlines? Let's break down the science, potential benefits, and risks. What is Ozempic, and how does it work? Ozempic semaglutide is part of a class of drugs called GLP-1 receptor agonists. These medications mimic a hormone in the body that regulates blood sugar, appetite, and digestion. For diabetes patients, it helps the pancreas release insulin and lowers blood sugar. For weight loss, it slows down digestion, reduces hunger, and helps people feel full longer. While the main focus has been blood sugar control and weight reduction, the drug's anti-inflammatory effects are now drawing attention from dermatologists and researchers. Painful skin conditions linked to obesity and inflammation. Certain skin problems are more common in people who are overweight or obese, especially those related to chronic inflammation. Two major examples include hidradenitis suppurativa, HS, a painful skin disease that causes recurrent lumps, abscesses, and tunnels under the skin, often in the armpits, groin, and under the breasts. Obesity and inflammation are major risk factors. HS often worsens with weight gain, psoriasis, and eczema. These conditions are also linked to systemic inflammation. Patients often see flare-ups improve with lifestyle changes, weight reduction, and anti-inflammatory treatments. Since Ozempic targets both weight reduction and inflammation pathways, it is no surprise that researchers are asking if it could double as a treatment for skin problems. The emerging research, skin benefits of Ozempic. Recent studies and patient reports suggest that GLP-1 drugs may improve hidradenitis suppurativa symptoms and reduce skin flare-ups. A 2024 study published in JAMA Dermatology noted that patients with HS who took semaglutide for weight loss saw fewer flare-ups, reduced pain, and improved quality of life. Another small clinical observation showed that patients with obesity-related inflammatory skin diseases noticed an improvement in skin texture, swelling, and pain after months on GLP-1 therapy. Researchers believe the benefits may come from two combined effects. Weight loss reduces pressure, friction, and sweating in skin folds. Inflammation control. GLP-1 agonists lower systemic inflammation, which may calm down overactive immune responses in the skin. Could Ozempic be a game-changer for HS patients? For people living with hidradenitis suppurativa, treatments are limited and often frustrating. Antibiotics, biologic injections like Humira, and even surgery are commonly used, but they don't work for everyone. If Ozempic and similar drugs can reduce both weight and inflammation, they may become an important new option for HS patients, especially those who also struggle with obesity. One patient described her experience on social media. After 6 months on Ozempic, not only did I lose 40 pounds, but my HS flare-ups almost disappeared. The pain is less, and I finally feel normal. Although anecdotal, stories like this are fueling interest among doctors and patients alike. Other possible skin benefits beyond HS. While most of the research has focused on hidradenitis suppurativa, scientists believe Ozempic might also help with psoriasis by calming inflammatory markers, eczema, through reduced immune overreaction, acne indirectly, by lowering insulin resistance and balancing hormones. It's still too early to say whether Ozempic could be a widespread skin treatment, but the potential is promising. The risks and side effects you should know. Despite the excitement, Ozempic is not a miracle drug and comes with risks. Some common side effects include nausea and vomiting, diarrhea or constipation, stomach pain, risk of gallbladder problems, rare but serious risk, pancreatitis. Additionally, it's not recommended for people with a history of certain thyroid cancers. Another concern is that long-term use for skin conditions hasn't been studied in detail yet. Doctors caution that patients shouldn't use these drugs just for skin benefits until more evidence is available. Why this matters in the United States. The U.S. is currently experiencing a massive rise in Ozempic and Wegovy prescriptions, with millions of Americans turning to these medications for weight management. The discovery of potential skin benefits could reshape how doctors approach chronic inflammatory skin conditions. For example, HS affects around 1 in 100 people in the U.S., and many remain undiagnosed. Obesity is a well-known risk factor for HS and psoriasis. If a single medication can target both weight and skin inflammation, it could save patients years of pain and expensive treatments. The future of Ozempic in dermatology. So, is Ozempic the secret solution for painful skin problems? The honest answer is, maybe, but more research is needed. What we know so far: it helps with weight loss, which alone can improve skin conditions. It reduces inflammation, which may calm chronic skin diseases. Early studies and patient reports are encouraging. What we don't know yet, the long-term safety of using it specifically for skin conditions. Whether benefits are due to weight loss alone or the drug's anti-inflammatory effects if it works better in some skin conditions than others. Final thoughts. Ozempic and other GLP-1 drugs are already transforming the way we treat obesity and diabetes. Now, they may be opening new doors in dermatology. For people suffering from painful conditions like hidradenitis suppurativa, the possibility of finding relief through a weight loss drug feels almost too good to be true. But while the early results are exciting, experts urge caution. These medications should only be used under medical supervision, and more research is essential before they can be officially prescribed for skin problems. Still, the idea that a weight loss shot could double as a skin therapy shows just how interconnected our bodies really are. The future may hold a time when drugs like Ozempic aren't just about the scale but also about healing skin and improving lives.